From the 35th meeting of the APA CRS in beautiful Singapore, I'm Josh Young. I'm here with Sri Ganesh. Sri, we're talking about a really current topic, which is the sort of ophthalmic clinical digital world. Tell me first of all why it's important. Why is this something that I should care about?
Yeah. Today everything is digital and digital connectivity. For a reason, because it makes things more efficient and safer. And today we have digital environments in ophthalmology, and I think Zeiss was one of the first companies to introduce the seamless digital environment. And you have digital workflows for both cataract and refractive surgery. For cataract, there's an integration of the IOL Master 700 through the Forum. Forum is a networking system which connects all the diagnostic devices of Zeiss. So through Forum you can send all the information from the IOL Master 700 to what is known as the EQ Workplace. The EQ Workplace is a remote planning software which you can use on a desktop or a PC or your tablet or your smartphone. And then you have access to all the patient information. You can order IOLs, you can look at outcomes, you can analyze outcomes and nomograms. And from the EQ Workplace, you can send the data, you can make the list for the day, schedule cases, and then send it to the Callisto via the Forum. The Callisto in the OR basically has the OT list for the day. You can select the patient. You also have a markerless system, so the data from the IOL Master, the images from the IOL Master are transferred to the microscope, and you have a truly markerless system for toric IOLs. And you also have all the recorded surgeries there, which can be stored again via Forum, and you can access it anywhere you want. So this again, in the OR, you have a surgical cockpit where the Callisto is connected to the Quatera and the operating microscope, the RTO 800. So all these devices actually help the surgeon. You have all the information about the patient, the name of the patient, the IOL to be implanted, your phacoparameters, everything on the screen there. And it's like a surgical cockpit. So you have all the information and you can do a very safe surgery. And because it's a electronic seamless transfer of data, you don't have any transcription errors, you need less number of staff, and for the doctor it's peace of mind.
So transcription errors and prevention and safety obviously is a big element of this sort of setting. Tell me, from which data sources, you mentioned the IOL Master 700, which data sources feed into this that will then present on my digital cockpit?
Yeah, you have the information from the IOL Master 700. You also have information from the topography, and of course with the EQ Workplace again is going to be replaced by the Veracity, which is the software available in the US. And there you also have patient information, patient history, if they've undergone refractive surgery, and all those other things which are very important in decision making regarding the treatment. And this basically helps the clinician. Managing such a large amount of data also is very important. For that, again, having a paperless digital environment is so much preferable because you can access all the data at one particular time.
Yeah, I mean that's great. Of course, one of the hurdles in a practice is needing to gather data and then going to a website to calculate something and you'll print out from the website to the OR. There are a lot of potential places where there can be errors. This all sounds great. Is there any way that when I'm done with the surgery to then get a summary of all that stuff into my medical record system?
Yes, in fact, you can integrate the Forum into your electronic medical records, and we have done that. So when you integrate the Forum into the medical records, then you have all the details from the diagnostics. For example, the IOL Master, the topography, and also your videos and photographs which are kind of embedded in the patient file, and you can easily access them. And that's very convenient. Even for if you want to access videos to make your presentations or review them if you have a complication, then it's very easy.
So it sounds like it's also less labor on the surgeon's part to make sure that all the ducks are lined up, as it were. So it's funny because I feel as if we're talking about something that's science fiction. It's not. It's actually going on now. But now I do want to talk about science fiction. How do you picture things playing out over the next, 4 or 5 years?
I think there will be data analytics and AI, which will be integrated. Already Zeiss is doing it. They have a software called Surgery Optimizer, where all the surgeries are recorded on the Callisto and uploaded onto a cloud, and you can access it through the Surgery Optimizer. So you have featured videos, you have your own videos, which you can access anywhere. So you can access it even on your mobile. You can compare two surgeries side by side. The AI actually splits up the surgery into different steps. For example, incision, capsulorhexis, IA, it's automatically done. And you can suppose you just want to review one step of the surgery, you can do that. So, and you can even share these videos with your colleagues and discuss problematic cases. And you also have for the EQ workplace, post-op you can do a IOL master and put in the residual refraction, and you can get personalized A constants. You have large data, so you have much more precise biometry and outcomes by using personalized A constants. With the refractive workplace, you have something known as the visualize, where you put in all your post-op refractive data, and then you can come up with nomograms for both the excimer laser and the Visumax, so that your outcomes are even better refined.
Shri, this is really, really cool stuff. I would confession, I went into ophthalmology for the gadgets, and I'm just so happy that there are many more now, and that they talk to each other. And so I want to thank you for bringing this really neat topic to us, and most of all, I want to thank you for the generosity of your time with me today.
Thank you. And I think we are all seeing this digital world. If you look at Apple now, they have integrated their Mac with the smartwatch, and the iPhone and the tablets. So this is the era of digital integration, and when it's happening elsewhere, why not ophthalmology? So this is the way forward.
Absolutely. Thank you so much, Shri.
Thank you so much.